Hi dear friends, welcome back. We are discussing about the muscles of the lower limbs. Right, so in our previous lecture we had discussed about the obturator internus muscle, right, this one. Now let us see about another muscle which is present in your gluteal region, that is pyriformis muscle, right. So this muscle is your pyriformis muscle, right. This is the posterior view and this is the interior view, which is hidden by this iliac bone. Let's see. Pyriformis muscle is the muscle of the gluteal region which lies deep to the gluteus maximus. Pyriformis muscle lies deep to the gluteus maximus and it is a little bit P-shaped. That's why we call it pyriformis muscle, right? Where does it arise? It gets its origin anterior surface of the sacrum. It gets its origin from the anterior surface of the sacrum. If you see here, right here, this is the interior view of the pelvic region. So anterior view of the anterior surface of the sacrum there, and then between the S2 and S4, between S2 and S4, sacral bone 2, sacral bone 3, sacral bone 4, and gluteal surface of the ilium. Gluteal surface of the ilium, it gets its origin from these 2 points near the posterior inferior iliac spine. So sacrotuberous ligament we call it, right. So it gets its origin from the interior surface of the sacrum and gluteal surface of the ilium, and it's inserted into the apex of the greater trochanter of the femur. It inserts into the apex, right. You can see here, this is the apex of the greater trochanter of your femur. So it inserts here, and what are its actions at the hip joint? It causes the thigh external rotation. Okay, whenever it will contract, your thigh will rotate externally. It will cause the thigh abduction, right. Whenever it will contract, it will pull your thigh laterally, right. That's why we call it thigh abduction, and stabilizes the head of the femur bone in acetabulum. Okay, we know that. What is its blood supply? It is supplied by superior gluteal artery, inferior gluteal artery, gemellar branches of the internal pudendal artery. So 3 arteries: superior gluteal, inferior gluteal, gemellar branches of the internal pudendal artery, and it is innervated by the nerve to pyriformis muscle, which comes from S1 and S2, right. So here are the details in the pictures. Here you can see this is your pyriformis muscle, and this muscle in our previous lecture which we discussed, right. So obturator internus this was, and this is pyriformis muscle, which is also shown here and here, and this is posterior view, this is anterior view, right, and this is your sciatic nerve, right. This was about pyriformis muscle, friends. The next lecture we will discuss inshallah about another muscle.